My name is Abubaker A. I'm a general surgeon. I perform everything that a general surgeon can perform. What takes me a step further is that I'm trained in minimally invasive oncology of the GI tract. I offer minimally invasive surgery for gastroesophageal reflux disease by laparoscopy or by using the DaVinci Robot, which is the most advanced minimally invasive platform that we have to date. And we're so fortunate to have it at Sinai Grace and Harvard University Hospital. Basically what that means is that I can perform laparoscopic esophagectomies for patients who have esophageal cancers. Compared to the traditional way where you have a big abdominal surgery and a big thoracic surgery, I perform them through a small 5mm to 10mm incisions in the abdomen. And the biggest incision is usually in the chest. It's about 4 centimeters, and that's where I extract the esophagus. And basically what the trocar is, a hollow metal that goes through the patient's abdomen, which allows us to pass the robotic instruments. And it's 8mm in diameter. And just to give you a concept of how small it is compared to a penny, and how small the needle driver is also compared to a penny. The advantage of doing these surgery minimally invasively is that you don't have the wound morbidity that a traditional surgery has. However, doing it minimally invasively does not mean that the patient is having less of a surgery compared to an open traditional surgery. You can still achieve the same oncological outcomes doing it minimally invasive with less pain, less wound infection, and less risk of hernias. I also offer minimally invasive surgery for patients who have achalasia, pancreatic cancers, liver cancers, colon cancers, and adrenal tumors. I call my patients myself after their discharge. I always make sure that the nurse in the room updates the patient family every 2 hours on the progress of the surgery. I always call the primary care physician. If the patient is admitted to the hospital, I make sure I ask them who they want me to consult. So, for example, if a primary care physician works with a cardiologist who works in our system, I always consult that cardiologist. And I always make sure that the primary care physician gets notes about the progress of the patient, and they have direct access to myself. They don't have to go through an answering service. They can call me. I'm available 24/7. They can call me directly on my cell phone, and I can update them. I also give some of my patients who are in need direct access to my cell phone, where they can call me and get they can update me on the patient progress. We offer a very unique service at Sinai Grace Hospital, which is a concierge service, where the patients, prior to their surgery, they have the option of coming to the hospital. It's just like a real concierge service at a hotel or something. They come in to the hospital, they'll be met, one of our team members will meet them at the door and show them the preoperative area, the operative area, where they get to meet the anesthesia team, they get to see the OR. After that, they go to the post-operative area to see where the patient is going to be recovered at. And during this whole time, the patient, if they have any questions, they can be answered. Usually during that time, the anesthesia team and the nurses will be asking the patient what relieves their anxiety. For example, if they have a dog that they'd like to talk about in the preoperative area, or they had a trip, for example, to Europe that they'd like to discuss in the preoperative area. It's all to relieve the anxiety. The patient and their family will be escorted to the floor, where they'll get to meet the nurses on the floor and have all of their questions answered to their satisfaction. And the whole purpose behind this is that we found that this reduces anxiety significantly, and patient gets to experience what they're going to go through prior to their surgery. Another thing that makes my service unique is that I have a multidisciplinary team composed of a nutritionist, a physical therapist, a clinical pharmacist, social worker, and a case manager. Though all those services are available at every single hospital, they're not routinely involved in the patient care. So I always make sure to involve all those services in the patient care the day they come into the hospital, so we can evaluate the patient home status and see whether the patient needs to go to a different place to get stronger, like to a rehab facility, and a clinical pharmacist that reviews all the patient medication prior to their discharge and educate the patient on the interaction between the different drugs and a nutritionist that will educate the patient. I'll do everything I can to make sure when the patient goes back to you, your patient is satisfied and you are satisfied with your patient care as well.